I have tons of scars from where the implant went in, where where there was an infection and they had to clean that up. I can't stand to look at myself in the mirror, honestly. It's just a reminder, a constant reminder.
5 years ago, Diane Hager found out she had stage 4 breast cancer. After a double mastectomy, months of chemotherapy and radiation, and 15 failed reconstruction surgeries, she was left with one option, a procedure called deep flap surgery.
If I can't get it, it's going to be devastating. It's going to take an emotional toll, and I'm going to need help dealing with that.
The procedure uses a woman's own fat and blood vessels to reconstruct the breast. For 1 in 5 breast cancer patients, it's the best option. But now, because of a code change in medical billing, the surgery that Diane and so many other women were counting on may be out of reach.
My concern is that fewer women are going to get access to advanced forms of reconstruction. Most of these.
Dr. Marisa Weiss is a breast radiation oncologist, the founder of breastcancer.org, and a breast cancer survivor.
No one wants mastectomy. No one wants reconstruction. So the reconstruction is their way to get back to feeling more like themselves. And there's really no price you can put on that.
But it appears the insurance companies have. Since 2006, doctors have been performing deep flap surgery using a unique billing code. Codes are a standardized language for the healthcare industry to properly bill for services and procedures. But starting next year, the specialized code goes away, and with it, the coverage for most women who need this complicated and expensive surgery that can cost as much as $100,000.
And if the codes are dropped and their payment is substantially reduced, it's unlikely that they're going to keep doing those procedures. And who suffers from that? It's going to be the women who want the best outcomes.
In advance of next year's billing code change, some insurance companies took the procedure off the menu and were met with pushback from the breast cancer community. Cigna, one of the largest health insurers in the U.S., said just days ago that it will delay the policy change and reprocess claims from surgeons so they'll be reimbursed at the rate prior to March 12th, when the company suspended the code. Diane Hager says it's a good sign that women's voices are being heard.
The insurance company weighed in way more than they should have throughout my entire treatment. The insurance companies should not have the power to determine what your treatment or your surgery or what the next step's going to be.
In a huge turn of events, we've learned that CMS, the Centers for Medicare and Medicaid Services, which determines code changes, has announced that for its June 1st meeting, reconsidering the code change will be the #1 agenda item. Sources tell us, depending on the outcome, it could mean an extension of the code or a complete reversal. CMS will be accepting written comments up until the meeting. Go to spotlightinvestigates.com for a link to get you there. For Spotlight on America, I'm Lisa Fletcher.